Hello, I'm Mallie Shansfeld, Managing Editor of Implant Practice US, a MedMark publication. Welcome to a live presentation and question and answer with Dr. Sathish Palayam. In our webinar today, we will be discussing robotic technology for full arch scans. Before we get started, I would like to invite viewers to use the chat box on the right side of your screen to ask any questions, and your questions will be answered at the end of the session. Also associated with this presentation is a free CE quiz. 1 hour after the end of this webinar, we will email all attendees the presentation replay along with the link to access the CE quiz. Now I'm pleased to introduce our guest for today. Dr. Sathish Palayam received his doctorate in dental surgery from the University of Colorado School of Dental Medicine. While implementing cutting-edge technology in his own private practice, he also travels the world, educating thousands of dentists on integrating exciting, fast-growing technologies. Dr. Palayam is one of only a handful of dentists in the state of Massachusetts trained on LANAP, an advanced laser-assisted periodontal osseous surgery, and LAPIP, an implant surgical protocol, along with 3D cone beam computed tomography, as well as its application in surgical dentistry with predictable outcomes. He also lectures on robotic dental implant placement and workflows. He is a member of the Massachusetts Dental Society, training new dentists on dental office compliance and standard of care for better and more predictable treatment outcomes. Dr. Palayam, we turn the webinar over to you to learn more about your topic for today.
Thank you very much, and thanks again, Molly, and thank you for helping us with all the technical glitches we had. So thank you again for that. I appreciate that. And thank you for everyone to be here tonight and spend the evening with us. And I'm sure it's going to be very exciting. I'm very excited about this whole robotic protocol that I've been implementing in my office. So without further ado, I'm going to introduce you all to the magical world of robotic dentistry. As you see, this is my contact information. I practice in New Bedford, Massachusetts. This is my email down there. If anyone has any questions, please feel free to email. I'll be happy to answer all your questions if you don't have time for tonight. I'm going to be assisted for helping me with my other slides. But to begin with, just an indication statement saying that, Yomi is the first and the only at this point an FDA-approved robotic or true haptic system. What that means is that, the FDA has made sure that, the indications are as a navigational system for the surgical phases of implant placement, both for dentulous or partially dentulous and edentulous conditions. So, we'll be talking more in detail about that. And, the newer softwares, as we discuss, are going to be really, heartwarming in the sense that so user-friendly and easy to use and talk about. So, let's go back to the next slide, please. And, Neocis is a company based out of Miami, and it's basically only available in the United States at this moment. And it's the materials that have been provided tonight is just for guidance purposes. As we're all professionals, we'll do our own research and our due diligence to make sure this is like the right fit for our practice. And I'll make sure that I'm able to, talk about every possibility and its great use that we can bring to and uplift our clinical expertise in implant surgeries, particularly. So, as I said, I've been sponsored to speak for tonight's lecture, and it's there are a lot of factors and a lot of things that we've been going to be talking about. That obviously has been approved by the FDA, and the point is that there is going to be adequate education and support by the company. And as I said, if any questions that I cannot answer, I'll be able to direct you to the right people in the company itself. So now what's important for us to understand as professionals is that we talk about, what we try to accomplish and the kind of factors that help us get intrigued into certain kind of things. And, I've always been inspired by Richard Branson, just talking about, if you get an amazing opportunity and you don't know much about it, you've got to basically say, you know what, I'm ready for this thing, and basically learn about this. And it's just not in particular just about this robotic system, but it's in general, in my whole practice, where I know I try to incorporate a lot of technology in my practice, as we talked about LANAP and LAPIP. But just not just that, we talked about how we can have a wholesome practice where we can integrate technology for the benefit of our patients, the kind of practice we can get into. So I accepted and embraced technology, and then I learned about it, and that was very intriguing to me. So I'm just going to share my experience with you all. And the next possibility was, of course, this man, very intrigued again. And when I heard about him talking about the fact that you can either watch it happen or you can be a part of it, and I chose to be a part of it. And then the way I started to devise or create a culture in my practice was that either I can see other doctors grow around me, or I can be the first to make sure that I incorporate this kind of technology in the practice. And that's always been my passion. And, that's what really has helped me bring Yomi to the forefront in my practice, and especially in my implant practice. So bottom line is that, as we know, as clinicians, as professionals, it's not about just the surgeon. Gone are the days where you're the rock star surgeon and, it's all about you and everything. But today's emphasis is about the rock band. It's your team. And this is my team. And the key part is that, every part of the team is so important to incorporate today's successful practices. It's not just about the fact that, you can go in and you can start, performing without your staff's assistance. And I want to share this in particular about this particular technology. As we all know, once we go and talk to our staff about, hey, listen, I just was on this weekend program or a course, and I'm just going to make this something in my, incorporate that in my practice. And they would be like, here he goes again. He goes on a weekend course and he comes back Monday morning, and there we go. We got to work hard, and there he's going to bring some more ideas and everything. But this was different. When we talked about the robot, when we talked about what it's going to be doing to our practice, I was very surprised and happy to say that every staff member in my practice was equally excited about this practice and about this technology. And that made a huge difference in them, kind of learning about it and learning the impact of what it does to the practice. I was very impressed. So again, it's a rock band. It's about the team. And it's important that, we create a team that works in tandem with our ideas and our cultures that we create. And I've been very fortunate to have a team just like that. So, when we talked about implant practice, there have been different ways of doing or placing implants, right? I mean, we talked about freehand placements. We talked about, which has been the traditional form or format of implant placements, like the ones we see now. With due respect, I'm not saying that, there are people who always do base placements that are not in direct parallelism to the neighboring teeth or in the right direction or right angulation. But it's really challenging. It's time consuming to ensure that you're putting an implant prosthetically driven in the right location, in the right position, in the right angulation. And it's always a challenge. So that's why, even as an expert, when I tried doing freehand implant placement, I would always be like, oh my gosh, I wish I placed it in a better angle. It should have been a little bit more mesial or distal, or with respect to basically having a crown down, technique. So that's when I started to switch to more like static surgical guides, which I'm sure I'm going to talk about briefly. And I'm also going to basically talk about how we can integrate a grid progression from freehand or just surgical static guides to more robotic placements and more dynamic placements, which is just absolutely fantastic. So next slide, please. So, why robotic guidance, right? So, first things first is that, there's always clinical implications. If you cannot put an implant in the right location, you're not really following the principles of a proper surgical protocol or a proper restorative protocol. So then you get into complications, you start to see failures, and more importantly, there could be some medical legal issues. When say you hit a nerve, you hit an important anatomical landmark, or you place an implant that's not restorable anymore. So they can get you into some serious trouble. So things like the slides that are showing up here, they're all true cases that I have seen in my practice that I get to take a look at, and I'm like, okay, I don't think I can really restore those implants. Or then you have clinical complications where the implants were placed like too facial, too buccal, too labial, and then you start to see anesthetic, gingival tissue recessions, bone resorption, et cetera, et cetera. So, obviously in today's times, the times are, we're talking about iPhones and not flip phones, advanced technology. So I really think that it's time for us to embrace the technology that we have so that we can start to contribute better clinical outcomes and better clinical experience for our staff, for our patients, and our staff also. And we can go back home and say, okay, yeah, probably I did a great job today. So it's important that we integrate some format of technology to understand that it's all about the planning. It's not just about going and blindly trying to place the implant in the best location possible. So we can completely eliminate that, and it's time to move out of situations where we are talking about a map quest like navigation. We're talking about just a GPS system or just a Tesla like system, which is very predictable, better outcomes, and you don't have to worry about dinging a nerve, not placing the implant in the right angulation or in the right projectiles, if you may, and it just makes it more like this is where I wanted to go, more precisely, more accurately, and that's the kind of navigation. That's the kind of dynamic navigation we're going to be discussing for tonight. Next slide, please. So as you notice, as we progress towards all the different technologies today, we talk about, like, say, let's give an example of the smartphones that we have. It's not just a phone, right? I mean, we just don't use that technology just to make phone calls. Like we browse the internet, we make sure it manages our schedule, our daily itinerary, our travel. It's a lot of things that we do. It's almost like a platform, right? So similarly, when you compare that to the Yomi robotics system, it's a platform today. It's not just about, hey, listen, we have the robot just to place an implant. We can actually integrate a great STL file into the software, which is so user friendly. Then you can actually create a restoratively driven implant placement that has a dynamic navigation system. So it's a win-win, right? I mean, in the sense, on one side, you're having either a single tooth implant restoration or a full arch restoration, and then you seamlessly integrate that with a DICOM file that you basically grab out of your CBCT, and then you have a seamless integration. So easy to do that you can either print a temporary prosthesis or mill one out, or even just get a lab to do it for you. Just makes it a slam dunk procedure, which kind of in my days when I started doing implants and trying to restore them, I would be like, I hope I get the right angle. I hope the restoration is good. I hope it's got the right, aesthetics and a right occlusion and everything. We don't have to worry about all those basics anymore because there's adequate integration of a lot of data that you put into the system. So it's a great platform to have, just more accurate and more just better outcomes and better clinical experiences. Next slide, please. So just about myself, I went to University of Colorado School of Dental Medicine. I graduated. I've been practicing for 27 years now. The emphasis in my practice was like, how can I have or impart cutting edge technology without the cutting? What I meant by that was basically, how can we produce clinical outcomes with minimally invasive approaches or protocols? So that's when I started to incorporate like lasers. That's when I started to incorporate CBCTs. But I still started to see that there's some missing components. Then I got in 3D printers, but there was no surgical parts that I was still kind of missing. I still was trying to either use like a static guide, or I was trying to use like almost like a prosthetic guide, but I wanted to make sure that I get to the next level with respect to minimally invasive techniques. And when I came across, my wife went to Boston University. I got it. You get those journals every month or every few months, and I looked at this robot, and that was very intriguing. So it was so interesting that the same day I called the rep from Neocis, and I said, "Listen, I'm very interested to learn about this thing. What can I do to get my hands on to those things?" So he was like, "No problem, doc. I'm going to get this right to your doorstep." So they drove this truck, a mobile truck, which actually had the robot in it. And when he brought it in, he parked it in the parking lot, and he was like, let's go for a ride, not on the vehicle but on the robot. So we did a few drills. My staff actually got into the truck as well, and they tried a few osteotomies on a model, and it was absolutely so breathtaking as a technology that we were like, this pretty much seems like it's helping me finish my connection about the concept about being fully integrated with technology, fully integrated from just proper digital treatment planning to a completely minimally invasive technology. And that's, I've not looked behind. I've placed more than, I think, 200 implants today with this technology, and every day I just enjoy doing this procedure. And I'm sure everyone who either has the robot today on this webinar, or who are planning to talk about or probably incorporating this technology, would equally be seeing the excitement, the enthusiasm, and how we can basically have this technology into this office. Next slide, please. So just to continue on the fact that as we go through these different procedures, as I said, I was talking about the missing component here. As we go along, what's also important is that you got to think about whom you're going to be looking upon to. So this is my great friend, a great mentor of mine, Dr. David Lusbader, who is an oral surgeon practicing in Massachusetts again, and he really taught me the importance of having advanced technology, the importance of having to be basically being able to incorporate good treatment outcomes where patients come in, they're confident, you're confident, imparting some real high-end treatment outcomes and better patient experience. So I really appreciate what he helped me drive in the direction of getting the robot to my practice. And I haven't ever since I've been, as I said, done multiple cases. And the biggest drive about this technology has been how it's just made me into a better surgeon, from just doing single implant placements to multiple full arch cases. And I'm just going to talk to you about the full arch cases. I know the internet is a little slow. And as I said, I've been having some technology issues today. But the point I'm trying to make here is that the fact is, this whole seamless integration just enhances and appeals to the fact that you can do a lot more today. I was kind of, when I started doing implant dentistry, I was fearful of the fact that what if it fails? What again if I'm not putting it in the right place? And that was just about single implant placements. But today, when I do full arch cases, the kind of seamless integration into the practice was just amazing. So I used to probably do like 2 or 3 full arch cases, maybe in 6 months to a year. Today, I average about 4 full arch cases a month, which is a huge dimension to the practice where you want to bring your practice up to, because full arch conversions, especially in today's times, are, it's the talk about the discussion in every office. It's becoming one of the mainstream high-end dental practice treatment options for our patients. It just brings in more value to your practice, more value to the bottom line of your practice, and overall, it's just a great experience. Just about some historical perspectives here, robotics actually, if you look at it, has been in existence since 2000, and it's more prevalent, has been more usual, more used in the medicine field of medicine and surgery and everything. But always, unfortunately, dentistry has always been late to the party, like as everything, right? I mean, it was not being accepted well. We always were like frugal with everything that we think about as dentists and dental surgeons, and never actually thought about like what can it bring in as an advantage, as a return of investment. And I can promise you that when you try to bring this practice, this technology into the practice, the ROI is absolutely exceptional. The biggest example I can give you is how I transitioned from using it just for placing single implants to a full arch case, and that's a huge curve up north. And also, as a comparison, when I started using static guides, say if I placed like 100 implants, I would average about $30,000 just on making or help just outsource it to a third party to a lab, and I would almost pay like close to $30,000 to get those static guides. Imagine we don't have to worry about that. We don't have to take those extra costs here. It's a same day procedure. You don't have to wait for any static guides to come in, and that was important. So when I got into understanding the robot, again, as I said, the mantra was minimally invasive. Historically, if you look at it, 1989 was a very important year for medicine and surgery. That's when the first laparoscopic procedure was done, and people loved it. And since then, on an average, just tons and tons of laparoscopic surgeries done. And then now there's a lot of talk about how an open heart procedure, imagine opening up a big an external incision, and then trying to recover from that. It's absolutely amazing how robotics can completely change or transition the way this same heart or a cardiothoracic procedure can be performed by a robot, wherein recovery is quick. Compared to a big deep incision on the chest, you just have a couple of holes where the robotic arm can go right in. So recovery is amazing. And that kind of discussions are happening today. So when patients are coming to our practices, and when either the hygienist or the doctor is discussing about their medical history and everything, they're like, yeah, I got a hip replacement done, I got this cardiac procedure done, and there was this amazing robot, and it was such seamless, it was great, my experience was fantastic, and then my recovery was fantastic. And now they're coming to you as a dentist, and you're talking about oral surgical procedures, and you're like, okay, I'm going to cut open, I'm going to flap open, I'm going to cut the bone and everything, I'm going to place multiple implants, you're going to be stitched out, you're going to get all bruised up, swollen up and everything, there's going to be some recovery time. They're like, really? I mean, on one side I got a hip replacement or this done, which is robotically done and so nice and everything, and now you're still talking about old school. Not that it's a bad plan, we still have to get to know or remember the principles of old school surgical protocols. But when you talk about advancements, when you talk about more advanced procedures and technology, they are like, yes, this doctor is pretty much well versed with what's going on out there. So the point I'm trying to make here is that we all work in our offices. What's key is that you got to work on your office. How are you able to bring your office to the next level? How are you going to be able to bring in technology to the benefit, not only about as a personal growth perspective, but also for the growth of the practice? And that's where these kind of technology really kind of seamlessly integrate into your practice. Next slide, please. So again, as I said, it has been used in different categories, ENT, lungs, abdominal procedures, dental, of course. So fortunately now we are not behind in this thing. We are, we want to be at par with our medical professional friends. We want to be at par with the fact that, we want to make sure that dentistry is not behind anymore. We want to be, going to the fact that yes, going to a dentist's office is probably talking about the most advanced procedures you could ever receive, and more patients are going to be willingly or ready to accept those kind of treatments, because most of the times then patients don't accept those kind of procedures is for fear. right? I mean, that's the most important thing. And when you talk about how seamlessly and quickly and effectively these things can be done, as a small example, if you are placing dental implants with free hand, we average about 30 minutes, 25 minutes, 1 hour, whatever it takes, depending on the level of expertise. Every single time you use a robot to get it done, you'll be done in about 10, 15 minutes. Super accurate, precise, quick, easy, predictable, with the right angulation that you want. And the biggest advantage is that you can actually change the treatment on the fly, which is pretty comparable to a freehand procedure. So you're not limited by the fact that, oh, the robot, once it gets done, it gets done. Not true. You can actually make the robot follow any changes that you like to make on the fly. And that's the beauty of this whole dynamic navigation system. Not just unlike a static guide where once you planned it, you planned it. You really cannot do any modifications to a static guide. And that's when you're like, okay, I got to abandon the guide and I got to go back to using a traditional manner or a freehand implant placement. So huge advantages there. I'm going to start talking about all the clinical implications and how to use them. So this was the comparison I talked about for an open heart surgical procedure. To the left of the screen, you see the size of incisions. Then the middle one is where the robotic open heart surgery is getting done. You can see post-operatively, you can see the size of the incision, nice, pretty long, big. So recovery is humongous, right? It takes a few months for the patient to recover versus the robotic, incisions. As you can see, it's literally just 5 darts on the chest. So, you don't have to go and break open the chest. You don't have to cut through the ribs cages. You don't have to cut through any important arteries or veins or anything like, or nerves for that matter. So you can precisely navigate through all these important anatomical structures very precisely. This is the Da Vinci, which is one of the first medical robotic system out there, and it's being run by the Intuitive Surgical company out there, a very famous surgeon out of California. So you can see the impact already that it has created in the field of surgery. So I guess at this point we should not stay behind, and as dentists, as dental surgeons, it's imperative that we show that yes, we in our field are equally advanced and are ready to embrace all this kind of technology into our practices. Next slide, please. So as we go along this technique here, so if you notice on your left side, this is a static guide sequence. You can see that there's a static bone level guide that has been fixated to the maxilla, and then that the bone leveling is done. Then you stack it up, and then you obviously place the implants. So that is either a traditional full arch flap technique with combination with a surgical static guide. You can see the extensiveness of raising the flap. You see the level of exposure that is needed or required. Versus to your right, you can actually see a robotic implant placement. You could barely see any incision that is opened up. And don't take me wrong, if we have to open up a flap or something, yes, we have to, especially in situations where we have to do bone leveling and or bone contouring and things like that. Yes, we have to, but it's super minimally invasive. The goal with the robotic system is that if you don't have to raise a flap, you don't have to. You can either do a tissue punch and go straight in because you've already planned it more effectively. So minimally invasive, and that fits into pretty much everyone's toolbox because patients would love it. Recovery is quick, easy, effective, and patients' experience is multifold. And once they talk about how easy and effortless this was, it becomes a huge marketing option for you as well. Next, please. So my impression at the end of everything, when I started to talk about the robotic system or learn about that for that matter, I was super intrigued. I was like, I don't have to wait for any of those 3D printers, any 3D printed guides or static guides anymore. Imagine if a patient came in, you did a CBCT, and then you do an intraoral scan or a PVS, you mail it to your third party or your lab, and then you wait for it to come back in 5, 6, 7 days. Yes, you can quicken the process, but then they would ask for like a rush fee, and I was tired of doing that. I used static guides for almost 10 years, and there were days where it wouldn't fit, or it would come in broken, or then I said, like, okay, you know what, I need to buy a 3D printer. I started trying to print my guides in the office, and then I started to see it was just consuming more of my time. And one time I printed the guide, and I was placing 4 implants on the lower arch. Only 3 little shells got printed, and the fourth implant was now, or the other shell never got printed. So guess what? So I'm placing 3 implants with using a static guide, and I was trying to place a fourth implant free-handed. I was like, oh my gosh, I mean, this is just not working for me. And then, of course, I had spent so much money, and all that money was either going towards my lab person who was fabricating the guide, and then also spending time on the webinars, treatment planning big cases. So it was just seemed like it was overwhelming my system. So that's when I started looking for other alternatives, and I got to know about the robot. But again, the goal was to being minimally invasive and to be able to complete my vision of how integrating this technology could really come up to the forefront on being minimally invasive as a technology itself. And of course, this really led to great patient care. So I got my Yomi in I think it was November or September of 2020. I could have gotten it earlier, but because of COVID and everything, there was a delay in, obviously with everything else, delivery was delayed. But when I got it, the first day I had the Yomi people come in. There was a boot camp with me and my staff and everybody. So it's a 2-day boot camp where the company made sure that there was a great onboarding experience on this technology as to how the staff members get trained on this, how you get trained on this, and then you schedule pretty much like a simple cases or multiple cases on the same day, and they would help you navigate through the process step by step. And that is important. So incorporating this technology is not about just having a weekend, like a webinar or something, but the good thing about this company is that they want you to be successful. That's the most important thing. It's not about buying this equipment and they are like, tada, bye bye, gone. No, what's critical is that they are present with you every single case in your office until you're like, you know what, I don't want you guys anymore. But they'll make sure that you thrive with this technology. They help you market and make sure that there's a nice marketing campaign that you establish for your practice. They make the onboarding experience as far as staff members goes also absolutely fantastic. So as I said, all in all, it is a huge win-win for the practice and myself personally, and being able to fulfill my dream as being a surgeon with all the cutting edge technology. And that's when I was able to incorporate a CBCT. So when now today's protocol in my office for a patient when they come in is that as soon as they come in, we take photographs. We go in and basically talk about taking a CBCT. Once we have discussed the treatment plan, we actually go right into surgery. There's really no waiting time, and it's especially useful when when patients come in with anterior teeth issues. And I remember one patient actually lost or broke his number 10, and he was getting married in a couple of days. And I was like so stressed out. I was like, oh my gosh, what am I going to do? So in the sense I could have done a freehand, but obviously, as we all know, that anterior implant placements are never an easy trick. So it has to be a 100% precise just to make sure that you put it in the right place in the location. So restoration or prosthetically, either temporization or whatever that is more effective and seamless. And I was able to accomplish all of that with the robot. Imagine getting to get a surgical guide or a static guide fabricated in 2 days, well, you're going to spend a lot of money getting that done. Is it impossible? Not really, but still, if you try to get a lab to get it done overnight, yes, there we go. So 195, 200, 250, $300, whatever it takes. It's a complete game changer with this kind of technology. Next slide, please. So again, it's not about the weekend training. I talked about the onboard experience with the company, and I talked about how the staff came in. They talked about installation, calibration of the equipment. On-site training was amazing with the boot camp, which is day one and day two. They made sure that they would make sure that we incorporate the technology in the practice pretty seamlessly with all the staff members, and they help you go and guide through each and every surgical procedure as we go along the day. And then it's just not the first 2 days. Actually, as I said, I've done more than 200 placements so far, but they still come to my office even today. In fact, this Friday, just this Friday, I think I have like 3 or 4 full arch cases lined up for the day. So as I said, that big jump from just doing singles to just 2 implants and 1 arch, and I have the confidence today to do multiple full arches and all even dual arches for that matter. So and that's been a huge change in the kind of procedures that we can do and try to accomplish to do in our practices, and that's the emphasis today. Next slide, please. So today's learning objectives were, which I'll be, talking about, is the clinical workflow. Like, what can we do? How is it? What is the most efficient way of incorporating this technology in the practice? And we also talk about as a comparison between static guides and the use of freehand placements versus the dynamic navigation systems. And we'll also talk about how the robot gets registered to the patient, what keeps the robot calibrated to the patient, say if the patient moves and doesn't move, and all those little things, as we go along the procedure. Next slide, please. So if you look at it again, techniques for dental implant placements are like the freehand ones, which is on the top left. Then we start to use the static guides. Then, of course, there's another dynamic navigation system called as the XNav, and we'll talk about that briefly. And then, of course, we have the true haptic robot. Now, what does haptic mean, right? I mean, haptic means that we are getting adequate, positive feedback with the arm, the control of the arm and everything. But it also, in addition to a haptic feedback, it has audio and visual feedbacks as well. And there are some videos along this presentation, and I'll bring your attention to certain audible sounds that really help you determine, and it gives you nice cues. And not only that, and then your staff members also like, oh yeah, you're at, say if you're placing like 11 millimeter implant, you're like, they give you feedbacks, you're at 4, you're 5, you're 6. It's constant monitoring. So that all that monitoring is huge, as far as it just creates a lot of security, and it makes sure that you're following the path, and then there's no screw ups. And that's why when I talked about medical legal issues, or not, you're not getting into nerves and other important anatomical landmarks, because there's so much security built into the system in the form of haptic feedbacks, audio feedbacks, visual feedbacks, and of course at the same time your staff are also talking about if there's going to be any things, any issues coming along the way. And more importantly, I think, yes, you can change the plan on the fly, and none of this technology that's been put other than just a freehand can actually do that. Next slide, please. So this is just a comparison about, how today's technologies like the Tesla, it's a self-driving capability, but at the same time, it's a true haptic, approach. Unlike those freehands, which is almost like a comparison to a compass. And of course, the I remember the MapQuest and the AAA maps were almost like those static guides. And that's the emphasis, right? We are transitioning from an era of using maps and paper maps to advanced navigation systems, and that's where it's important in our surgical protocols as well. Next slide, please. So the advantages are, And if you look at this table, it's very clear. It says, yeah, same day surgery, freehand, it's possible. Surgical guides, unless you're able to print or anything with a quick printer, same day surgical procedure is not possible. But for the robot, it is. Minimally invasive options, surgical robotics, a big green check mark on that. Digitally integrated workflow, very important today. Again, possible. Physical guidance to the plan, we talked about that. We talked about visual. We talked about the other important thing is that we talked about, and we should talk about, is the standard drill kits. And this is key, of course. Every manufacturer has their own surgical kits and everything, but it doesn't have to be unique to the robot. But if you use a static guide, you got to make sure that you have a surgical kit, and then you got to maintain a lot of inventory for all these things. You got to make sure you got the right sleeves, you got the right keys, you got the right all the combinations. But with surgical robots, you can use any implant system. You can use any surgical kit that comes with the manufacturer. You can use any universal kit. There's really no restrictions on what kind of drills you really want to use. And the most important thing being the intraoperative changes. As I said, you can do or change the treatment on the fly. And visibility and irrigation access is pretty effective, because if you notice, and if people on the audience have used surgical guides, and especially the stackable guides, there could be challenges as far as the irrigation goes, right? Sometimes the cooling or the coolants may not even reach the tip of the drill. So you can get into issues of heating the osteotomy side and getting into all those complications. So what has the robot done for me? You know, as I said, I've been practicing for 27 years. There are all these issues when you started with certain levels of procedures. You started talking about what are the things I can do to get out of my comfort zone, because you kind of get comfortable at a certain position, right? Oh yeah, I'm only okay doing a single implants. I'm just okay doing a couple of implants here and there, but I don't want to do the full arch cases because I'm worried, I'm scared that it will not go as per plan, or I could complicate matters. That's where the whole dynamics changed. Where when I started to do like single implant cases with the robot, I saw with what ease it could be done, with what integration it could be done, and that really helped me propel my practice towards full arch cases. That's what transformed my practice. And it's very enjoyable. It's not a stressful day anymore. We have either you can have the lab person be with you during the surgical procedures for a quick conversion, or you can even actually have a PMMA, milled or printed in house or from a third party. Because, as I said, it's a platform. It's not just a one surgical kit anymore. You can integrate all your prosthetic and pre-prosthetic planning and get it all prepared beforehand, because there really is not going to be any major diversion. Because I know the challenges are like, oh, what if the prosthetic part does not fit into the implants that have been placed? But as I said, if there's not much of a deviation from what the surgical protocol was, then there should be a proper, quick, easy, conversion of a prosthetic system into a full arch case. And all this really helped us go into those more complex categories of implant surgery. And soon I think that, it's going to be history, and it'll be easy for you to place like pterygoid implants, zygomatic implants, because you're not going to get patients into your inner practice with ideal ridges or ideal sinus positions or locations. Then how are you going to address those things? And imagine if you're able to get into dynamic navigation into those kind of implant placements, it's a huge deal. So it's coming. So if you look at the robot itself, there are a few components, right? I mean, there's a patient tracker arm. And remember, I told you that there's a tracking device. For example, if the patient is sitting on the chair, just under local anesthetic, and if the patient moves in a particular direction, the patient tracker arm is kind of situated along the splint, and I'll show you a few images going forward. It helps track the position of the patient. If the patient decides to move, the robot is going to move with the patient, so you don't lose the calibration of where exactly the implant is going to be placed. Now, today the robot is pretty much seen in most of the major meetings we have. So people who go to the meetings, make sure you go to the Yomi booth and try it for yourself to see how these things work, and how seamlessly the whole process gets started. So it's just amazing. Next slide, please. So this is my operatory. You see that it's not a big, humongous, huge machine, because I get these questions a lot, like, "Oh my gosh, this machine looks really big. Is it going to fit into my operatory?" But no, I don't have a huge operatory. I tuck it towards the corner. When I need them, I pull it towards me and my patient and everything. There I am. I'm actually doing a full arch uppercase, talking to the patient while the staff are actually getting everything ready and prepared. As you see, the machine has been draped, and we are getting ready for surgery. So it pretty much fits in any operatory as possible, and if necessary, the plan can be modified, and just about the thing, about where it can go. Mostly, for the most part, I have the robot on the left of me because I'm a right-handed surgeon, but also I can have my motors and everything on the right side, so I can keep an eye on everything myself as well. And you see there are two screens to the robot. So the bigger screen, the patient, if they want to watch the surgical procedure, they can. I like to watch few things here and there. I don't have to constantly look at those screens, which is a huge thing, because that's a huge advantage over XNAV. Or because for XNAV, you have to look at the screen. If not, you're not going to be able to do the necessary procedure. But in this case, you don't have to, because, as I said, you still have the haptic, the audio, the visual feedbacks, and then of course your staff are they're going to talk about the different sequencing methods. And then you see a laptop on the left side. That is where the robotic driver controls the laptop. That's where you kind of tell him, like, okay, get me a free on the robotic arm, or you put him into the guided mode, or you're going to pause the thing. So that's where all the controls happen. And that's where the person is called the robotic coordinator. So I talked about being a rock band, right? This is where the importance of team integration happens. This is where everyone is involved for the best outcome of your patient. And as I said, there's no more stress in the operating room. Everything is happening like with a nice ease, and patients are actually experiencing this. Of course, patients are going to get nervous about these experiences, but once they get numb, once they start to expect what to be expected, their outcomes are very positive. And after every procedure, I make it a point to get a proper, honest feedback from the patient. I really, out of almost 200 plus implants I've placed, I had one patient say, "I don't want to get this done again." So realistically, that's huge, right? It's almost 99.9% positive experience. And why wouldn't you not want to have a technology that's going to help you just make you a better surgeon, talk about better outcomes, and also start to do more complex cases? Next slide, please. So the workflow is that we talked about. First is obviously, you got to get the CBCT, you got to transfer the DICOM into the robotic software, planning software, and then you go into surgery and it's restoration. Next slide, please. So in the workflow, we took the CBCT, the pre-op risk. Now, sometimes if it's just a single implant or something, I don't even take a preoperative CBCT. I just go on the day of surgery. I go take a quick CBCT, and then it literally takes me anywhere from 5 to 10 minutes to actually plan placing the implant. But if I do like more than two or multiple cases or full arches, then I prefer to get a preoperative scan, so where I could plan all the cases. And then on the day of surgery, I take another CBCT with a splint on there. I merge them together, and then I go into surgery. Pretty seamless. Next slide, please. So this is a splint, and this splint, as you see, it's shaped differently. It's a tooth support splint. We use a bite registration paste to kind of stabilize this. And this can be done for either a single implant placement or a couple implants in the same arch. The key is that this splint has to be placed on the same arch that you're placing the implant, obviously on the opposite side. So that is key. So as you see here, once you see this little orange or yellow bite registrations up there, and then I'm trying to torque the screw in so there's good stability. The key about the splints is rigidity. You got to make sure that there's no play or none of it is moving, because if that's what's going to happen, the robot is going to be completely out of whack. So that's crucial. You got to make sure that this is rigid and accurately placed. and actually accurately secured to the teeth structures. You got to kind of, not warn the patient, but alert the patient that there could be some pressure when you're trying to mount those splints on. But overall, the stability is key. And once it is done in place, this stays as is. And we talked about the tracking arm, and this is where the tracking arm comes and engages to the splint so it can track the movement of our patients. Next slide, please. So this one, and this was one of my, can you go back a slide, please? And when you looked at it, exactly, so this is one of my full arch cases. As you see, I did all the extractions first. I show you an image of all the extractions, and then I placed the splint. We'll go to the next one. So this is now there's a newer generation of the splint, and we'll talk about that in a second. So once the splint is secured either to the teeth with the help of bite registration material and securing a screw, or you place it with the edentulous ones that you actually using fixation pins to fixate into the jawbone, just like using surgical guides where you use fixation pins. Once they're really well secured, then you put the fiducial. The fiducial is key because there are fiducial markers in them. And once that is done, you bring the patient into the CBCT. Next slide, please. And now we are taking the CBCT. Once the CBCT is recorded, you're basically taking the DICOM file and then you're transferring the DICOM file into the treatment plan software. And let me be honest, the second generation treatment plan software has become so much easy because I told them one thing: listen, we are not computer engineers. We're not going to be kind of navigating through multiple clicks or everything. It has to be easy. Just press a couple of links and little buttons there. Of course, now they're touch screen, so you just press on the touch screen and you go right to where you want to go versus navigating through multiple categories of softwares or windows or whatever you call it. Next slide, please. So once you've done the scan, now we're going to talk about a quick planning session here. So next slide. As you notice here, go to the next slide, please. Yes, there we go. So as you notice this on this thing, you see how the planning software is. You have teeth numbers. You select a particular tooth there, and now the easy thing is that you already have pretty much a lot of the implant manufacturers in the library. So you pick up the system you want to use, the size and dimension and everything. And once you pick that tooth numbers or the site that you want to place it, it drops the implant in that site automatically. All you have to do, if you notice certain blue lines that are kind of on the peripheral of the implant, that is giving you like the 3 millimeter mark. So it's no brainer there. You want to make sure that you're 2 or 3 millimeters away from like the nerve, or 3 millimeters or plus away from the next door neighbor implant. So there's really no major calibration. You don't have to get a scale or a ruler or something to measure anything because it's right in front of you. So that really helps you place the implant, and you can review that on the axial, on the sagittal, and the anterior posterior, the mesial distal, positioning of the implant. And once you're placed, if there are multiple implants, if it's a full arch, you can also adjust how parallel you want the implants to be. And say, for example, if you're using multi-unit abutments or anything like that for a full conversion, you can also even have the multi-unit placed on top of them, which is so super cool that you can either choose a 17 degree or a 30 degrees. So as I said, prosthetically driven, you know all this information beforehand, so you don't have to struggle with any of this on the day of surgery. So you know beforehand the kind of size of the implant, size of the multi-unit abutment, angulation of the multi-unit abutment, and then once you've actually done a digital wax up, you can print your own PMMA for a quick conversion. Amazing, right? I mean, that's what we're talking about, step by step, that the software and the technology really drives you from point A to point B without any much of the tumbling blocks as we come across. Next slide, please. So it's again performed in standard dental offices. A robot on the left, as we talked about it, surgical assistant, and the robotic assistant. This is pretty much my setup. I have one person holding the suction and everything. I have one person who's a robotic coordinator, and then I'm just holding the robotic arm and placing the implant. Next slide, please. So that's the tracking arm, as we talked about. And it kind of basically goes and it hold, that is the surgical arm, and it goes and it holds against the splint directly, and it helps us secure it onto the splint. So if the patient moves, it just helps us track the movement of the patient. As you notice there, it follows the path of the patient, and this is exactly how it is secured to the splint. And once it is secured, like the one on the left you're seeing is a single tooth implant. I was doing an extraction of number 14. I was doing a combination of a sinus lift and an immediate placement. I'll show you a radiograph of that. And sinus lifts, again, with the robot, are absolutely seamless. And the best part of it is that it actually, when you're actually torquing the implant in, the mount is held by the robotic arm, and the handpiece, it securely kind of places it into the sinuses. It is so secure. There's a lot of safety in there because you're not going to dislodge the implant into the sinus, which is one of the biggest nerve-wracking experiences you may ever have. How do I know that? We've been there, we've done that. That's why when I start to see those little simple things and simple secure things that the system can do, is just amazing. Next slide, please. And then once we've planned, as we showed it on the planning software, you go directly to do the procedure. So let's go into surgery. So once you're selecting the drill bit, you obviously, what you got to do is to select a landmark, because the landmarks is a reference point that you already kind of decided. Okay, for example, if you're placing an implant or number 12, for example, you pick, say, the distal incisal of, say, number 9. So you go point out to the distal incisal of number 9, and then it would say, yes, confirmed, that's the landmark. Then once you go into number 12 position to start the osteotomy, it knows that, yes, this is the most accurate position to be at. Next slide, please. And again, robotic guides, it does the location, the angulation, and the depth. Next slide, please. And this is a video, so let's watch it. I'm not sure if you're able to hear some of the background noise, but as we're going through the video, you could see how my robotic coordinator is giving me feedback on like where I'm at, the angulation, the depth, and everything. But also it kind of starts to give you like audio feedbacks, like it gives you beeping noise, like beep, 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 things like that. It's telling you that, yes, we are at depth. So you don't have to worry about, like, am I all the way down? Is my osteotomy complete? I don't have to worry about all. Yeah, here we are. I think I'm getting some audio here. You heard a single beep. The single beep tells us that I was in the right angulation. And as I'm drilling through it, at the end of the drilling sequence, once I'm at depth, it's going to double beep me. And the beauty of this thing is that, again, once I'm at depth, even if I try forcing my handpiece further down or the drill further down, it's not going to let me do it. Amazing safety. That's not with any technology that's out there, including the XNAV. With the XNAV, you keep drilling through it, you're still going to be able to, but not with the robot. It stops you from going further deep. So imagine if you're in a very sensitive location, you don't have to worry about that. So in this image, I think it's a video, but you can see that on the top big screen, you see the green handpiece. It's telling us that I'm still not in the right position. So it's actually telling me to change by about, say, 5, 6, 7, 11 degrees, whatever it is. And then my assistant is also telling me, hey, doc, move more towards the mesial, more towards the buccal, more towards the distal. So things like that. So it's just, so you can see that there's a little, like, an angulation there. It's now it kind of merged together. It confirmed that I was in the right position. Now, as you see, as I'm drilling, it's gradually showing me the depth. It's going further down to depth. And once it has gone to depth, you're done. So your osteotomy is literally done in about a fraction of a minute. So it's that quick. just as a comparison, the other day I placed, I think 4 or 5 implants on the lower arch. This is a robotic time. It still just took about 15 minutes, 4 or 5 implants, starting from the first osteotomy to the actual implant torquing. So this is what I was talking about, how as you're trying to place the handpiece, it's actually asking you to move in a certain degree, 10 degrees in this case, and then you're in the right position or the right location. Next slide, please. In this situation, it's just telling you, look, go more lingual, 4.5 millimeters lingual, and then you'll be on the right spot. Next, please. Then we are just drilling down into place at 11 millimeters. So in this slide in particular, it's just telling me I'm 5 millimeters into the osteotomy and I have to still go further. So it's just constantly talking to us and giving us information on where I'm at as far as the depth and everything goes. Next, please. So what we always do is that once we have done the placements, we always go back and get another CBCT after the implants have been placed, and we just compare the actual location with respect to the treatment plan. And 99% of the times, guys, and again, I'm not exaggerating this, it is the exact location of where the implant has been placed with respect to the treatment plan. So that's why it's a huge plus, especially when you already planned a full arch case for conversion and you already have a PMMA, the drilled, a milled or printed or whatever it takes. It's just minor adjustments here and there. If you have a spinner or something like that, yes, you got to do some modifications, but how often does that happen, right? If you use the right amount of size of implant, right length and everything, you are going to be able to get some primary stability. That's why it's so different, and that really kind of motivated me to go from just single placements to full arch cases. Next, please. Yeah, that is the same case. That was the preliminary planning, and this is the actual placement. As you see, there really wasn't much of a detour. And even though the panoramic view shows that I'm super close to the metal foramen on both sides, but if you actually look at the plan on the sagittal view, I'm actually 3 millimeters away from all the necessary, because when I've done the nerve mapping on the software, I'm making sure that I'm well secured and not dangerously close to those nerves. Next, please. And this literally took about 15 minutes to place all those implants. So delivering the accuracy and precision every single time, there's no reason why it shouldn't have to not be accurate, because you planned it, you followed all the necessary protocol, you did everything step by step. And the accuracy is phenomenal in the sense, if you actually, there was a study that was conducted which said that if you used a static guide, there is actually a 15-degree variation or variance from where you actually planned the implant to where actually it got positioned, versus if you do it with a dynamic system, it's almost 5 to 8 degrees. So that's a significant number, because especially when you're in upper anterior regions, you got to be as precise as you can. And that's important. As we know, we don't want to compromise they or sacrifice the necessary bony more prominence or the actual location, how you place palatally or labially or lingually, or it depends on those things. So those things are accurate information, and the accuracy just gets better and better with dynamic navigation systems. Next slide, please. So there, if you want to do more further studies, there's a lot of articles on the Journal of Periodontics and prosthetics. So there's a lot of research that's been done. There's a lot of reporting on the FDA as well. As you notice here, the actual placement of the implant versus the planned implant, there's really just about in the mean value, see 0.42 on the signed coronal depth, and the angular deviation has been 2.56, which is very minuscule as compared to when you're doing multiple cases, and depending on which jaw you place. So there's really not much of a deviation from your actual planning itself, which is pretty significant, because I don't think that you can accomplish that with freehand procedures or freehand placement, I don't think you can accomplish the same results with basic static guides because there could be more deviation in the kind of systems we have. Next slide, please. Similar thing. If you look at the left slide, that is the planned placement of the implants, and on the right is the actual implants placed. As you notice here, there's really not much of a deviation in the angulation or the actual positioning of the implants themselves. So it's pretty significant, pretty huge, and pretty satisfying, which is one of the huge components to just help you build up your confidence when you want to do full arch cases. So this is what's another important thing is that as I started to indulge into full arch cases, I talked about marketing and PR and everything. And the company actually came up to the front and they actually had hired a PR firm and they worked very closely with me in my office to bring me out, in the news. And this is like a TV article. Actually, one of the journalists, a health journalist came out and they interviewed us and one of the patient experiences. So if you can play me that video and hopefully we are able to listen to all those aspects.
Robot-assisted dentistry. Millions of Americans over the years have had medical procedures via robot, but now there's a new FDA-cleared dental robot. It's for a specific use, and a local dentist is using this new technology. Robert Zala has long been a take charge kind of guy, so it was no surprise that when this former Dartmouth police chief chipped a front tooth at home, he didn't hesitate to get in to see his dentist immediately.
It was still hanging a little bit at the time.
That was when he found out the tooth had to come out. He needed an implant. He also learned about something new, a first of its kind robot assisted system.
Typically, when we did any kind of virtual planning with implant dentistry itself, we would have to have the patient come in multiple times to create as much data as possible.
Here at Arohi Dental in New Bedford, they've been using this robotic computer navigational system since last year.
It's actually scanning the patient's mouth. When it is doing that, it's customizing his new crown that we're actually going to place on the implant. And it's going to be a perfect blend as if he never lost that tooth.
It was so quick and easy.
All told for Robert, about 27 minutes.
Imagine that, 27 minutes for the entire process. I thought it was just preparation for the procedure. That's how quick and harmless it really felt.
With 3D, three-dimensional treatment planning and virtual treatment planning, you can literally have 3D scanning of the patient with a combination of 3D photography.
Robert walked out that same day with a new implant and crown.
I wanted something that was efficient, accurate, quick, and very appealing to the patient. So that is why it can be a same-day procedure, in and out, pretty quick and effectively done.
Dr. Sathish Palayam says he's used this dental implant robot on more than 100 patients so far. He says with good results. If you have dental insurance that covers implants, he says it will cover this as there is no additional charge. More on the story at turnto10.com.
So as you notice here, the company helped us with the PR, of the robot and the system and everything, and a lot of people started to talk about it. And as they talked about it, we started getting a lot of inquiries on this new technology and what we do and everything. And we did a lot of consultations. We actually got a few patients, maybe 3 or 4 patients, full arch cases, just from patients listening to this ad. So as I said, this company makes sure that that not only the onboarding process, but also making sure that you're successful with adequate marketing support and adequate training and everything. So it's a great experience. So just to conclude, right? I mean, why robotics? Because of this accuracy and precise implant placements, minimally invasive, very efficient and precise. It helps in proper planning on the location, angulation, depth, etc. And it just benefits overall patient experience and outcomes, treatment outcomes, and just less complications, which is what exactly we want as we start to provide all this different complex care that we do. Next slide, please. And just as comparison with the XNAV and the surgical guides, issues with surgical guides, we know about that. They're expensive, they take time, they may not be a good fit sometimes. So there's a lot of things that we got to look out for. And then, that is a big advantage with the robots. You don't have to worry about all that. You have better control over systems, and you don't have to worry about whether it's going to fit or not fit. And you don't have to wait for any of those things to come in. Next slide, please. And versus the XNav, it's a great system to have, but of course there are limitations, especially with full arch cases, and no depth control. This line of vision, which is key. You got to look at the screen and everything. So again, it has a role to play. It has its place, but it doesn't have a true haptic navigation system. So there's some problems with that. So, anyways, that being said, that's why the true robotic system is way more advanced. And then obviously it's a no-brainer. I mean, comparing freehand implant placements to robotic placements, we are talking about antiquated technology with free hands. I think it's time for us to move on with better outcomes, better systems, and better patient care. So that's key for us going forward. And that's why it's important that you look into the system, get intrigued by the system, learn about the system, and be a part of the system, be a part of this technology. And again, if any questions, feel free to email me, and I'm happy to be around to answer any questions you may have.
Thank you, Dr. Palayam. There are some questions coming in, but before I get to those, I would like to invite our viewers to use the chat box on the right side of your screen to ask any questions that you have. First question, what was the tipping point that made you want to invest in robotics?
Great question. So, I talked about how frustrated I was getting because I had to wait for the surgical guides to come in. And there was one time I was trying to do a full arch case with a surgical guide, and it did not fit. And I felt like a little weird because I felt like the osteotomy was actually not even in the bone, and I had to abandon the case, and I had to reschedule a patient and everything. And so that was one of the conditions. The second thing was, I started to see that one patient wanted to get his front tooth replaced as soon as possible, and I didn't want to do it freehand because of aesthetic purposes. So I had to wait, and the patient kept calling and calling and calling, and like, oh, when am I going to get this done? Because I can't really go out, and he wasn't going back to work and everything. So that was challenging. But then the biggest disruption was the fact that the amount of money I was actually spending towards those surgical guides, that was really overwhelming. And that was like, I need to find a better technique to do this.
Okay. What was your staff's reaction to bringing robotic technology into the practice?
It's interesting, right? When we talk about robotics, right, people get very intrigued. And this is, as I said, the first technology. I have quite a few, as I talked about in my presentation, but this particular one, right, when the staff got into that little van that came in and they started doing their own placements, they were super excited. And during the boot camp also, I noticed that every single staff member was like asking many questions, and they really wanted to be a part of this. So I have 4 surgical staff members, and they're all the robotic coordinators. They all know how to operate this system and be drivers. And I really liked, and they were so passionate about it. I remember when we went to the Dentsply Sirona Vegas convention, and there was a big billboard on the Yomi, and they all started yelling, "Oh, our Yomi," and everything. So I saw the passion in them. My hygienists, I'm so applaud by the fact that they talk to all our patients about this technology. So it's about a very positive feel about this technology and their involvement. So I really appreciate that.
What is involved in the training or the onboarding for the robot?
So the ongoing onboarding process was very smooth and very, of course, as we talked about, a lot of learning curve in the procedures and involving technologies, particularly the trainers and the engineers and the doctors who were on there to train the staff and us was pretty smooth. I feel like they went step by step. They didn't rush through anything. They wanted to make sure that we understand and learn the technology pretty precisely and accurately. And as I said, they've been with us all along and made sure that we are successfully trying to integrate this technology. And the best part today, we don't place any implants non-robotically. And I'm very clear about this. Every implant that gets placed in our office is done robotically today.
Wow. What has the return on investment been like for you?
Well, yeah, the biggest thing is that I feel like we've started to do a lot more full arches than we've done before. So that is one, and the biggest saving is on the surgical guides themselves. So if I was averaging say 100, 200 patients, I would spent close to 40 grand, 50 grand on just surgical guides alone. And that was significant. So, and I didn't have to invest into any kind of surgical guided kits or anything like that. I didn't have to maintain huge inventory on implant systems and things like that. So it made a big difference. And I feel like, as we're doing more and more complex cases, it's a no-brainer.
Okay, and our last question, as far as I can see, what are patients saying about receiving robot-assisted treatment?
I mean, they are comparing it to more advanced, procedures in the office. They're talking about, they're going and talking to their friends and their relatives and their family and saying that how intrigued and how seamless they had a great experience about this thing. And, I feel like they enjoyed the experience. And not everybody says that, but I feel for the most part, they had a good experience and their outcomes were very positive.
Excellent. Well, thank you everyone for your questions, but we've run out of time today. And if we did not get to your questions, we will answer them after the webinar via email. In 1 hour, we will send you a link to the replay of this presentation and the link to access the CE quiz. Be sure to complete the free CE quiz associated with this webinar to receive your continuing education credit. Thank you again for attending, and a special thank you to Dr. Sathish Palayam and our sponsor for this webinar, Yomi by Neocis. Thank you and have a great evening.
Thank you, everybody, and good luck.